Hello, everyone. Welcome to the Frank and Lizzie Show. We're here live at SAWC Spring 2025.
I'm Lizzie Faust, and I'm here to talk to you today with our very special guest, Kara Couch. Welcome to the Frank and Lizzie Show.
Thank you so much
Welcome.
for having me.
What we have now, we have a guest with us. She's not a stranger to the Frank and Lizzie Show. So we're going to ask Kara Couch from George Washington University Hospital to tell us what she's up to.
So it's been a busy few years since I saw you guys last, but right now I am the Director of Wound Care Services at GW Hospital. And with that, I oversee all inpatient and outpatient wound care operations, and also do some work for our corporate partner, which is Universal Health Services, to work on the wound care community as a large throughout the system.
Oh, wow.
Oh my gosh. All right.
That's a large system.
I saw the inpatient side of our system, and I know what a burden that was. But I think one of our pain points was it was like the outpatient and the inpatient weren't connected. Like we had different documentation systems and all kinds of stuff. And I know that was like a big pain point for us. So I'm sure overseeing both of them really helps with that continuity. So tell us a little bit more about what challenges you're seeing in terms of that continuity.
Well, this is not my first rodeo in wound care, being at GW. I learned as I grew. And so one of the first things I did when I took over as director was to integrate the inpatient and the outpatient services, because it doesn't make sense to have that disconnect with the patient. They deserve to have the same group of people and who are doing the same level of care and standard of care throughout the system. So we even pulled our inpatient team down to the outpatient wound care center, which we're lucky because we're located on the lobby level of our hospital. Sometimes people have a physical challenge where they're not in the same space, but with that, everybody is together physically. And so when we get our consults in the morning, the inpatient team can help triage that. If we admit people inpatient from the clinic, there's a handoff from there. Sometimes the outpatient clinic nurses go upstairs and treat their patients if they need a dressing change, like a vac or multi-layer compression, bandage change, things like that. So it really helps to maximize the resources, but being patient-centered, which is the most important thing.
Yeah. Wow. And I was in a system that it was not as robust as yours, but electronic health record is very important. So can you tell us about how that transition has helped you using an electronic health record?
Yeah, and I have worked at one point on 3 different electronic health records where our outpatient provider practice uses one, the inpatient team uses another, and then we had a separate wound care EHR, and the systems talked very fragmented to each other. So now we only have 2. Isn't that great? And they sort of talk to each other, but not. But what we had to look for was on the inpatient side and our outpatient wound center, they are on the same system, which is really helpful because then you can go back and look at the notes and everything is integrated more seamlessly, which is really what you need to try and strive for if you have the ability and the luxury to help it factor in those decisions.
So which electronic health record did you select after having so much experience with multiple?
Well, so we use Cerner right now, and then our outpatient practice uses Epic. And then we built out our wound care program within Cerner. And then we added in some other technologies. There's a type of app that we use where we worked with Net Health Tissue Analytics to help bring in digital imaging and measurements of the wounds. That is a tab that sits that everybody in the hospital can see, which is great because that way, if we have just done, say, admitted a patient or done a dressing, they don't need to take everything down. Or if the teams can't get to us to meet inpatient, there's 6 different teams involved, they can look at the image anytime they want. It's right there in the patient's chart, uploaded through the cloud.
So both inpatient and outpatient are using Net Health Tissue Analytics.
Yes.
And the wound just has one home then.
It has one home
and it's across it.
Yeah. So it's really great.
So important.
Yeah, it's so important because everybody needs to be working from the same information.
Yes.
And so that platform just really makes it seamless.
Right. So again, I'm talking about a large system.
Yeah.
How does your team prioritize? Because if you have a lot of consults, you're going to have some critical consults. So can you tell us about
Well, so that's the beauty of being able to use technology like this, because we always say, if you see something, say something and take a picture. And so, any new patient that comes, see something, say something, take a picture.
Yeah.
And so we use different apps and things like that. But with that, taking the picture, we can prioritize our consult. So we come in the morning, Monday morning, and I have 3 inpatient WOC nurses. We had 25 consults this week. So how do they prioritize? They can look at the images that we have and then digitally figure out, okay, that's a priority. I have to see that. I can do a digital consult on this. Huge time saver. Yeah. And then also it just really helps us to get organized throughout our day. And we can share the pictures back and forth where I could be sitting in my office on the first floor and one of my nurses has a question, or a nurse from the floor, and they say, oh, I uploaded the image into Net Health Tissue Analytics and it's right there. Yeah. It's such a time saver.
And so even the bedside nurses are able to upload into this system, and then it's visible for everybody.
It's visible for everybody. And so it's an app that they have on their phone that they carry. Yeah. And it's just every nurse is trained on it. We have little badge buddies on how they do it. They have their stickers everywhere. And then certain wound care specific fields like infectious disease, vascular, podiatry, my team, we all have it on our devices as well. So everybody's speaking the same language.
Yeah.
One of the issues that I find is that when you have continuity or the lack of continuity from inpatient to outpatient, it feels like the patient's starting right over and you're having to figure out what inpatient did and outpatient, vice versa. Can you tell us a little bit more about how Net Health Tissue Analytics helps with that patient continuity?
Well, it helps tremendously because, again, say we're seeing a patient in the clinic for weeks and weeks and weeks, and that's one of the joys of wound care. You get to know your patients really well, and then they get admitted into the hospital. They're seeing a whole new group of specialists who don't know the wound history or chronicity, and they can look back and see, okay, well, this is where it kind of things fell apart, or it was doing fine until this point. And then also you progress that continuum to their discharge. And it's insanely helpful that if the patient comes back to the emergency room for a wound issue, that the team can look and say, oh no, they got discharged last week. This one looks exactly the same as it was. Right. Instead of at 2 o'clock in the morning, they're not having to wake somebody up who may be on call but not know about the wound. And so it makes a huge, huge difference.
Or even
they love it.
An unnecessary admission. And I would think, is there reporting aspects to it as well? Can you use these from the Net Health Tissue Analytics? Can you use a report from them to help with let's say working with a payer or to justify some of your decision making?
Oh, absolutely. And so not only that, we have it so that we can tag all of the images into our notes. And then we set up our EHR that all of our pre and post debridement measurements automatically flow into the note.
Oh, that's
and so
nice.
all of the measurements flow. But if you're doing a procedure or something, well, it's a regulatory requirement. Yes. You have to have that. Yeah. So instead of toggling between and scribbling down on a piece of paper, you can just it just goes. So yeah, it work smarter, not harder, right?
I love that. I love that so much. I need that in my life.
She does.
It really is my favorite.
but nowadays we talk about time is tissue. Yeah. Okay. Tissue is time, either way, back and forth. But the thing is, you're saving the time. We talk about the 4-week marker. We talk about all these things. And so it sounds like this electronic health record can produce this robust data.
It really can. So you can get a portal where you can look at your outcomes data, which is so helpful because, again, we don't have time to physically write these things down. Right. And at a glance, when you're using the Net Health Tissue Analytics, it tells you from a color code if the wound's improving or not. It's either green, it's better, or it's red, it's worse. So you're math is not my thing. It takes the math away, thank God. So you can figure that out. But then also I can get reporting outcomes. As a director, I have to be responsible for my program, and I can filter it by provider on healing rates and things like that. So if I want to do a 4-week snapshot, like you said, the 4-week time is tissue, who's doing better, there's ways that you can mark that in the system. And you can even, if you wanted to figure out, okay, how many of these patients had this dressing or this application, and figure out if you're moving things along from there. It's really helpful. That's outpatient side as well, but on the inpatient side, from a quality standpoint, patients' safety indicators are a huge thing. All we talk about are CMS and leapfrog and these things. So PSI-3, which is hospital-acquired pressure injury, is the bane of my existence. I know it's the bane of your existence as well. But having technology like this really enables us to say, this was present on admission. Yes. This did not happen on our watch. So all of our admissions, they are required to take a picture of anything that's present on admission so that we can then paint the picture and go back and say no, this is how this cascade started. It's very, very, very helpful.
So here at SAWC, I'm going to be lecturing on the holistic care of the patient. And my perspective is around pressure injury care. So I know we mentioned like we've created continuity within inpatient, outpatient. How does that flow to the patient? Like, does the patient get to see how their progress is, or how do you like make the patient the center of that so that they have buy-in for their wound as well?
Well, it's really helpful to be able to show them how their wound improved, or if it's deteriorating, like what's happening here.
Yeah.
And because it's an app that's embedded, right on our phone, especially if it's a wound on the bottom of their foot and they can't see it,
Yeah.
like you can show it to them and know. And I always laugh and I say, yeah, I'm taking a picture with my camera, but this is all HIPAA compliant. Nothing's like, on my phone. And they're like, oh, that's fine, that's fine. I think it's important to explain that to them. But, like images are powerful,
Yeah.
and especially if they need to understand the severity or we know that wound care patients get depressed and they get anxious and they worry about things and they just want to see that something is happening.
Yeah.
So you can show them the trajectory of like, no, we're moving in the right direction and let's just keep this train rolling. And it gives them a lot of comfort in knowing that, that we can also look back and they're not just relying on the memory of their provider, that they think things are better. We have objective data where we can show them that things are better.
Yeah, I once got told by a lawyer that all wound pictures look bad in a courtroom. So it's one of those things that's showing progress and showing them what a healthy wound looks like and when they're healing, what it looks like and the things they should look for. I love that integration of the patient and being able to have tangible things that aren't like above their head. Pictures are easy.
Yeah,
the reading level is 0.
Exactly. The patients also really enjoy it. Again, like I said, it's patient-centered care because they're not constantly having their dressings taken down or things when they're inpatient. You can just send it, tell that if you can't get 6 teams together. I mentioned this before, I know, but it's really hard. And then sometimes you get everybody together and then the patient's not ready or something's happened or they need pain medicine. So then you're like, okay.
Yeah.
But
coordination of care can be
coordination
super
of
hard.
care is really difficult.
Right, which I do want to ask. We talked about the patient component, how compliant can help them, but I'm more interested also in the provider. So I'm sure there's a report that can be provided to the provider, right?
Yes, absolutely.
Okay.
If they want to know what their own data is, you can filter it down from there. Like we have a drop down when my nurses take the picture that they select who the provider was. So that way I don't have to, they say like have my list, but it can be like, no, this was the person that was seeing this patient during this time. And also, even just like basic things like if I want to look at the quality of a debridement, the pictures are labeled pre and post debridement. Well, they're labeled post debridement. So I can look and see, and the patients can see that also too. Like, yeah, it looked like this and then now it looks like this. Super, super helpful, especially when you're trying to, keep everything moving along in the right direction.
Yeah, and gain that buy-in.
Yeah.
So you talked about that you've used other electronic health record systems or ways of doing this, and I know there's a lot of options out there that we can use for our wound photography and measurements and all of that. So how did you land upon net health tissue analytics for your institution?
Yeah, so I'd been exposed to it probably 8 or 9 years ago, honestly, because we've been using it since November of 2019. This is not new technology for us.
Well, yeah.
I started it on the inpatient side first. Again, the priority was working out hospital acquired versus present on admission. And then we integrated it into our outpatient flow. They were so jealous that the inpatient team had it because they were still stuck doing point and shoot and uploading with a USB cord and not having that objective, measurement that takes away all the inter-rater reliability issues with like eyes and pencils. So, it really just, kind of like worked seamlessly from there. So I think I heard about it. It was a no-brainer slam dunk concept because how many times do we guesstimate how much a wound is? And I have a picture of the back of a dressing with a patient with 12 pressure ulcers, and I'm just writing down measurements, and I'm like, writing tunnels, and like it's approximately this and approximately that.
Yeah.
Takes all the guesswork away.
Yeah.
And then it's done, and it saves like 20 or 30 minutes of charting. So like I was like, please give me my time back. Like you said, Frank, time is like time is tissue, and time is the most important thing that we as providers have. So anything that I can do that's gonna,
we have time.
Well, I mean, I've heard about it. If you find it, let me know. But if anything we can do that's gonna automate and work smarter and make things so objective and so easy, I'm here for it.
Yeah.
Let's do it.
Yeah. I love this phrase. It's called AID, where you automate, initiate, and delegate. Automate whatever you can, initiate only the things you can do, and delegate the things that another person of a lesser skill set could do.
I'm
and I think
totally
that's
stealing that.
perfect. Yeah, perfect. I love it. So, all right, awesome. Well, thank you so much for joining us today and talking
thank
to us
you.
about net health tissue analytics.
Yeah, and thank you. And if you want more information, please go to the website. Look up for Net Health Tissue Analytics, which is nethealth.com. And so thank you again. Thank you, Kara.
Thank
Love
you so
being
much.
with Lizzie.
Such a pleasure being with both of you.
And be sure to subscribe to the Frank and Lizzie Show for more episodes.